GOUT. This is an inflammatory disease in which monosodium urate crystals get deposited in the joints. It is a crystalline inflammatory, asymmetrical monoarthritic disease that involves more peripheral joints, especially the first metatarsophalangeal joint, due to the deposition of microscopic crystals, that is monosodium urate, in joints, and is more common in males than females in the ratio of 4:1. The joints become red, hot, tender, swollen. Usually affects the first metatarsophalangeal. It is asymmetrical and usually monoarticular. Welcome to SR Medicine. Don't forget to subscribe, notification button, like, share. And primary gout. Gout can be primarily caused by inborn error of purine metabolism, lack of hypothyroidism, guanine phosphoribosyltransferase, and glycogen storage disease. Gout can also be secondary, caused by either overproduction of uric acid in the body or less excretion of uric acid. It is not common in premenopausal women because estrogen is uricosuric, increases excretion of uric acid. More common in middle-aged men, 42 years and above. It is a type of crystal arthropathy. Causes: hyperuricemia. This is too much uric acid in blood. It causes formation of sharp crystals in areas where blood moves slowly, like in joints and kidneys. Uric acid, which is above 6 mg per dl. Uric acid crystals form easily in cool temperatures. That's why gout mainly attacks extremities of the body. This damages the joints, resulting into arthritis. Normally, when cells die, they do release nucleic acid fragments. These are broken down to form purines. Then purines are converted to uric acid. This uric acid is passed out in urine. However, what we should know that uric acid is not so soluble in blood. Hyperuricemia occurs when the levels of uric acid exceed its solubility in blood. When it happens, uric acid loses a proton at a pH of 7.4 of blood to form urate ions. These react with sodium ions to form monosodium urate crystals. Therefore, increase in purines increases the risk of gout. What are those conditions which may lead to an increase in purines in the body? Apoptosis, that is programmed cell death. Other uric acid is obtained from consuming foods rich in purines like red meat, seafoods, alcohol, organ meat, and beans. Increased production of purines in the body. This may occur when high fructose corn syrup beverages are taken. These increase the synthesis of purines in the body. Decreased clearance of uric acid. This is caused by dehydration and alcohol consumption. This increases the rate of uric acid precipitation in blood. Obesity and diabetes are risk factors for gout. Chemotherapy and radiation therapy. Here, the rate at which cells die increase above the normal, leading to the formation of more purines. Genetic predisposition to overproduction of uric acid. Chronic kidney disease, unable to excrete uric acid. Medications like thiazide, diuretics, and aspirin increases levels of uric acid. Therefore, decrease in urate excretion by the kidney is caused by heredity, kidney disease, medication like diuretics, alcohol use, and lead poisoning. Gout affects the first metatarsal joint of the big toe, a condition known as podagra, which is characterized by morning pain in the joint, pain more severe in the hours after attack. Pain can last for days to weeks. It can also affect other joints like the knee, the ankle, the wrist and elbow, toes and fingers. The crystals form in the above joints due to low temperature of the synovial fluid. Local inflammation is usually caused by white blood cells which migrate to the joints to eliminate acid. Urate crystals can also form beneath the skin that is around the joints to form hard lumps called tophi. Tophi are subcutaneous deposits of uric acid, which are not painful but can limit joint motion and lead to deformities. Complications: increased risk of osteoarthritis due to deposition of crystals in the joints, and also kidney stones blocking urinary flow. Diagnosis: clinically, aspirating fluid from the joint to rule out septic arthritis. If no bacteria in the joints, positive for gout. Presence of needle-shaped crystals. Presence of monosodium urate crystals. Negative by refrigerancy. What happens when an X-ray is performed? There are some changes. Joint space is maintained. Punches out erosion, as you can see from there. Then sclerotic borders and overhanging edges. Those are the X-ray changes. Treatment of pain and inflammation. First line management: NSAIDs like ibuprofen, indomethacin. These reduce prostaglandins associated with pain and inflammation. Colchicine, which inhibits white blood cell migration, is also used, and mainly for people with renal failure and heart disease, simply because NSAIDs affect the kidney and the heart. Colchicine also causes diarrhea. Colchicine low dose is a second line treatment for acute gout attacks. It is obtained from coccus plants. It inhibits activity of phagocytes, inhibits leukocyte migration, and also phagocytosis. It is used during the 48 hours of gout attack and acts as an anti-inflammatory. Corticosteroids like prednisone and prednisolone, their third line, are not commonly used, simply because they are immunosuppressants. Therefore, if there is a problem with diagnosis and it is septic arthritis, the disease may be exacerbated. Treatment of underlying cause: diet modification, well hydration, avoiding soda, alcohol, red meat and seafoods, stay active to avoid overweight, manage hypertension, treatment to decrease uric acid levels. Xanthine oxidase inhibitors like allopurinol and febuxostat, more selective and more expensive. Usually purines are changed or converted by xanthine oxidase to uric acid. Therefore, whenever allopurinol is used, it inhibits increase in uric acid by inhibiting xanthine oxidase. Allopurinol is only started when there is acute gout attack. Uricosuric medication like probenecid. This increases excretion of uric acid. Usually, urate is reabsorbed into blood by a transport protein. Probenecid competes with urate for the transporter protein. This reduces reabsorption of urate, and therefore this increases its excretion. Increasing uric acid excretion increases risk of kidney stone. Therefore, individuals that use probenecid should take 4 liters of water a day. Thank you for watching. If this video has been helpful to you, don't forget to subscribe, notification button, like, share, and feel free to email me.